I wanted to see what kinds of thoughts you have around the issue of, where the provider system, and we understand from an integrated care delivery system, the ACO model, but that requires, well, it doesn't require, but that's how they want it, people to be locked into the system. And that kind of, is conflicting with Quality Path. And I was wondering any thoughts you have on that issue.
The lock-in is the easy way out for people to say, I got to have the patient locked in. What they should do, in my opinion, is they should do what every other business does who doesn't have their customers locked in. They treat them as customers that they need to get to stay with you for repeat business. But it's critical, they have to know who those customers are. That's why I said that the patient has to at least say who their physician is. They might only have to say that for a month. But if they say to the PCP, this is my PCP, right? Now it's up to you to keep me in your patient panel. The doctor knows that, and the doctor's getting paid in a way to do that, then, and it's going to take a little time to get there, but then the physician has the incentive to do that. And if the patient's not happy, the patient should be able to leave, just like every other customer does. Now, that physician should be able to convince that patient that if they think that the other physicians in their ACO, integrated delivery system or whatever, are better and will work better together for the patient than they would get by going out and self-managing everywhere else, then they should have the ability to convince the patient of that. And if they can't convince the patient of that, then it's their problem, right? The patient should be able to leave. But again, you have to have a payment system that actually supports people's ability to be able to do that, and the patient has to at least say, I'm going to give you a try to be able to get there. And there are providers around the country that are doing that are actually managing patients without lock-in effectively. But it takes a little bit of time and a little bit of education to be able to get there. And it puts the pressure then on that provider system to say, you know what, if your orthopedic unit isn't as good as the one down the street, then maybe you better either fix it, or maybe you should get out of the orthopedics business and figure out how to use the one down the street. But if the patient's locked in and has to use that orthopedic unit no matter what, then how's that ever going to happen? But it's like every other business, right? You got the customer and you say, I got some other product lines I would like to sell you. But the patient looks at that and says, do I think your product lines are as good as the other people's or not? But that customer is yours to lose. That's what I would be encouraging them to do. But you do need to give them a transition to be able to get there. Other questions or challenges or disagreements? Oh, come on, somebody. Just one more question. Here he comes. Okay, two. All right, go ahead. Ladies first.
Yes, okay.
She ran faster than you did.
No problem.
So I would just like to challenge somewhat.
Oh, thank God.
So in full disclosure, I do work for an insurance organization. I work for Group Health Cooperative here in Madison.
Uh-huh.
And I'm not saying that the insurers are blameless, but I wouldn't say they're completely to blame. And you spoke in your presentation about the...
Notice she admitted that they're to blame.
I'm sorry?
Notice that she admitted that they're to blame, just not completely to blame.
I think we're
Okay.
all equally can
Okay.
share in the blame. But the challenge I also see is when you talked about changing the philosophy of more is better.
Yeah.
And I truly believe there are many healthcare executives in this country who haven't quite bought into
You're absolutely
your
right.
theory of reducing is not necessarily a bad thing. So I just wanted to say that.
Well, I think that's absolutely true. Now, first of all, we have not offered them an alternative. You have to offer them an alternative. Where has anybody offered them an alternative? Well, so for example, in Maryland, and I'm not advocating the system, but it just gives you an example of what can happen. In Maryland, they have an all-payer rate regulation system. And they regulate what all payers pay to hospitals for care. But what they started to do a few years ago is the hospitals in the rural parts of the state, sort of the only game in town, those hospitals, they said to the hospitals, we're going to pay you differently. We're going to give you, they call it the TPR system, the total patient revenue system. We're going to give you the hospital budget. And so here's how much money you're going to get to be able to provide hospital care to the people in the community. That's what you're getting. Now guess what? Those hospitals have completely and totally changed the way they go about business, because now all of a sudden patients who come to them are a cost. And if they can they have embraced readmission reduction, they have embraced chronic disease management in ways that no other hospitals in America have, because those hospitals know that in fact they can actually do better financially if they can help those patients stay well and stay out of the hospital. Now you have to match that with quality measures, right? So they're not keeping people out of the hospital inappropriately, and they're doing that there. And there's other situations around the country where that has been done. Now there are, again, everything takes time. We have a whole generation, multiple generations of physicians and hospitals who have been trained with, electric cattle prods, that the way you survive is you get more patients in the office visits and you put heads in beds in the hospital. And you don't just suddenly turn that off overnight. And there are some people who run hospitals that are kind of, world dominance mode. But I'll tell you, I have talked to a lot of hospital CEOs around the country. And a lot of them are desperate to find a way out of this current system. And you know what? They would love to have the opportunity to sit down and talk to employers. I've asked them. They've said, we would love to do that. We don't know how. We don't know how. Because, in fact, all the communications go through the health plans. And the health plans tell you that, the doctors and hospitals don't want to do anything differently, and they tell the doctors and hospitals that you won't go along with anything differently. And if you get in the room together and talk to each other, you might discover that you actually have more in common than you realize. Yes, sir?
Hasham Sheikh, I manage healthcare benefits for a large company near Waukesha.
Hi.
Hello.
Thanks for coming.
Great presentation. I'm trying to put yours and Dr. Tuxton's all the concepts together. And the thought that came to my mind was, in healthcare, we do all of these experiments trying to do better, and it's all done locally because healthcare is local. Just curious onto your thoughts is that if you need to have one giant experiment, what the price should be for anything around the country, and what the quality should look like for the consumers around the country. Just like I know my iPhone or the car quality, car ratings, it's consistent. So to really help all of us having sort of these micro conversations, have that conversation at once, and we get past some of this cost and quality and move into some of the concepts you're talking about. I know it's a bit out there. I'm just curious if is there something being done at a national level around cost and quality?
Sure. If I understand the question, I think that you don't necessarily want to have everyone in every community learning completely independently of each other. But what you don't want to have it turn into is we'll wait for somebody in Washington to figure out the one-size-fits-all solution. Or we'll wait for the big national health plans to figure out what the one-size-fits-all solution is. Because guess what? We've been waiting and it ain't come. What does work, as I said, healthcare is local. The problems are different locally, but you want to be connected. And so, for example, we do have mechanisms around the country through, for example, an organization I used to run called the Network for Regional Healthcare Improvement that has communities that are working on these exact issues. How do you measure quality and cost, and how do you help people transform to communicate with each other to be able to share best practices? So that before you launch some particular initiative, right, you can see, has anybody else done that, and is there anything that I can learn from what they've done? And maybe, if you have an opportunity here to work on, dealing with ischemic heart disease, and somebody else somewhere else is going to work on oncology, that you'd say, all of us can't do everything all together all at the same time, right? So if we do that, then we can actually learn from each other and then be able to put those things in, and essentially kind of do rapid cycle system change improvement in a more efficient way. So that does exist, but there is this over attention, and employers are to blame for this, and so that they only want to use national health plans in many cases if they're multi-state. And there's some national employers that have seen that doesn't work for them. So Intel, for example, said, not working for us. So they are contracting now directly with provider systems in New Mexico, with Presbyterian Health Services System in New Mexico, and with Providence Health System in Oregon. National company, international company, but they have different contracts, different benefit structures, different payment structures in those different markets with those different systems. And there's several other national employers that I've been working with that are looking to do the exact same thing because now would they ultimately like to be able to have something national? Sure, and we may be able to get there, but you have to go through, some experiments, and you kind of take the opportunities where they exist to be able to get there. So I would encourage you to do that. Don't make your first reaction that I can't do anything differently in this market. Because if you could do something differently and better in this market, that's better for you, right? So figure out how to do that, because the current system ain't working